OK, let's explore more about the situation on the ground. I'm joined now by Thienminh Dinh, who's an emergency doctor for Doctors Without Borders, working in Tyre in southern Lebanon. Thienminh, great to have you with us. I do appreciate your time. So we have this crisis situation, a fifth of the population displaced, medical facilities destroyed across the board. MSF have now launched a nationwide emergency response. What, in your view, are the most pressing problems you're facing?
I think what I'd like to make clear to everyone is that it's not a ceasefire, and I think everyone on the ground can tell you that it's a ceasefire in name only. Civilians are still dying, children are still being bombed, paramedics and journalists are still being targeted. Just this week, we've treated families in the emergency department. I had a few days ago a 2-year-old and a 4-year-old who had depressed compound skull fractures, pulmonary contusions, broken limbs, calling out for their mother. And it is so hard to tell a 4-year-old that it's going to be okay when you don't know whether their mum isn't there because she's died, she's been separated, or she's just trapped under rubble. I passed by mass graves on the way to work where the graves are lined by number, and there were new numbers this week, and they were civilian defence workers who had been killed in a double tap strike while going to rescue other people. So on top of all these ongoing acute injuries from ongoing airstrikes, we're now faced with complications from chronic diseases that have been neglected. You know, outpatient departments have had to close during this war so that they can direct their resources to trauma and emergency care. So people with heart disease, with kidney disease, with cancer have had their care neglected. And what MSF sees time and time again in these contexts is that people die, not just from the airstrikes, but from chronic diseases that have been neglected.
It's all so very distressing, everything you describe. What facilities are there left to try and treat people like those patients you describe, including that poor 4-year-old?
Yeah. In the south, hospitals have closed. Multiple primary healthcare centres have also closed. And on top of that, there are people who haven't moved from their homes, haven't had the means, who don't have access to any kind of primary healthcare because the doctors have been displaced as well. So we're seeing people who haven't had any kind of medical care in months, have run out of medications. Just today, I've had people coming up to me on the street asking me for medications that they've run out of. And we know time and time again, it's not speculation, we see it in these contexts in the past, that people will die because of this neglect and lack of healthcare.
Tell us what aid you and other organisations have managed to provide and what is most urgently required.
So Doctors Without Borders, we've deployed 23 mobile medical units across Lebanon, including South Lebanon, and there are a number of other humanitarian organisations on the ground as well. We're providing support to a number of hospitals and healthcare facilities in Central and South. But what we essentially, I can treat these injuries, I can treat these kids, but what we do will not stop the war. We can save lives, but it will not stop the war. What we need is for airstrikes to stop falling on civilians. We need 100 healthcare workers have died in this conflict. We need for doctors, nurses and paramedics to be able to operate safely and to treat patients without worrying about whether they're going to die too.
Often forgotten element of all of this in these kind of situations, of course, for those who survive it all, is the issue of mental care and helping people's mental health. How do you go about that?
What we're finding, especially in the south of the Litani River, that mental health services are few and far between, and that's something that MSF is in discussions now of providing to the civilians down here. But, we have a few days ago a child who was orphaned, and what is there to say to a child who has lost his home, his parents, and everything that he knows to be real? We have I know of nurses I've worked with who now have PTSD. Every time they hear a door bang or close, they think it's a bomb. It's on top of all these physical injuries, it's a profound psychological trauma.
It's a deeply troubling situation you described there in southern Lebanon, and the trouble is there's no sign of it letting up in any way. It's just dreadful. But Thienminh Dinh, awful story that you described, but we do appreciate you telling the world about it. Thienminh Dinh, emergency doctor for Doctors Without Borders, joining us there from South in Lebanon. Thank you.
Thank you.